I will address the health professionals follow-up study. And I'm sure David knows a lot more about this than I do, but this is a study that is a sort of a partner study to the Nurses' Health Study, which was on about 280,000 women. There were 3 cohorts, one in 76, one in 89, and one in 2010. And they've been followed for many years. And the health professionals follow-up study was about 50,000 men. And again, following to see who develops what based on various lifestyle choices. And both of these studies have been also combined in a number of write-ups. And I can tell you, this is not one study. These are literally thousands of reports based on these cohorts. And these cohorts have informed nutrition policy. And the outcomes have been really quite profound. So we've learned a lot about how smoking impacts health, how alcohol consumption impacts health, why we need to eat more fruits and vegetables, and why red meat and processed meat may be damaging, or at least that they are damaging. And so, and sugar, and so on. So these are, I think, are very important studies because they've given us information about very large populations and what protects health and what doesn't. And they come from Harvard, as you probably know, and you may want to add a little bit onto that.
Good answer, Brenda. And yeah, just a little bit. So the question was, why do we like it? I don't know who said we did like it or if we all do like it. But if we like it, I think, the issue is there is no, well, let me ask you something. Anybody do carpentry or use tools of any kind? Is there any one tool that's right for every job in anything you can think of, right? Science is the same. So methodology in science is a toolkit. And the best way to answer a given question is the tool that's matched to the question. The tools of science are different ways of asking and answering questions. So what I like about the Health Professionals Follow Study, the Nurses' Health Study, other large cohort studies is they provide a view from altitude you're never going to get with a randomized controlled trial. So we should get the answers we can from RCTs, but what happens to large populations over 30 years and more? You can't randomly assign people to eat different ways for the next 30 years. Nobody's willing to play. So what I like is they populate an important gap. They provide the view from altitude. I think when we're telling you what we like about methods, it's also important to acknowledge limitations. And one of the concerns about cohort studies is they're not as good at proving cause and effect. They show association. Now, sometimes that's the same as causality. Sometimes it's not. It's important to distinguish. And the other issue is, and there's some legitimacy here. It's too bad Walter Willett's not here because maybe he would argue effectively against this. But there is the concern of so-called data dredging. So we've got 150,000 people. We've asked them about all kinds of things for 30 years. We can test any hypothesis under the sun. Maybe we're interested in the correlation between your favorite color and athlete's foot. And we find in our data set that people who like chartreuse tend to be particularly prone to athlete's foot. Who cares, right? So there's the risk of, hey, we've got a huge mass of data, we can ask it anything. And some of what issues from that, and this is a perennial concern in epidemiology, can be absolute nonsense. The best way to safeguard against that is to make sure that you're posing good, sensible, defensible questions in the first place, and that the associations you're exploring are supported by other kinds of evidence and are mechanistically plausible. When the Health Professionals Follow-Up Study is used that way, and it usually is, it's a tremendous asset.